Why are Signet ring cells important for diffuse stomach cancer? Imagine a tiny cell that can tell us a lot about how a certain type of stomach cancer behaves. That cell is called a Signet ring cell, and it plays a key role in understanding diffuse stomach cancer. These cells are special because they have a lot of mucin inside them, which pushes the nucleus to the side, giving the cell a shape that looks like a signet ring under the microscope. This unique look is more than just a visual cue. It reveals important biological features of the cancer. Diffuse stomach cancer is different from the more common intestinal type. Instead of forming gland-like structures, the cancer cells in the diffuse type are poorly cohesive, meaning they don't stick together well. When more than half of these cells are signet ring cells, doctors consider it a major part of this subtype. This kind of cancer tends to be more aggressive, spreads quickly, and is often harder to treat successfully. The presence of signet ring cells helps pathologists identify this specific type of cancer, which is important because it behaves differently from other stomach cancers. The significance of signet ring cells goes beyond just identifying the cancer. They are linked to a more aggressive disease course. Tumors with many signet ring cells tend to invade the stomach while deeply and spread early within the abdominal cavity, especially to the lining called the peritoneum. This often leads to a poorer outlook for patients, although early detection can sometimes improve outcomes. The presence of these cells indicates that the cancer is poorly differentiated, meaning the cells look less like normal stomach tissue and more abnormal, which often correlates with a worse prognosis. Another key point is that signet ring cells produce a lot of mucin that stays inside the cells. This mucin makes the cells less sticky, allowing the cancer to infiltrate the stomach while more diffusely. Because of this, the tumors are more difficult to detect early and tend to spread within the abdomen more readily. This infiltrative growth pattern makes surgical removal more challenging and can lead to earlier spread, complicating treatment. Speaking of treatment, cancers with many signet ring cells often respond less well to standard therapies like chemotherapy and radiation. Their unique molecular makeup and growth pattern mean they are less chemosensitive, which can limit treatment options and effectiveness. This highlights the importance of tailored treatment strategies and the need for ongoing research to find better ways to manage this type of cancer. Signet ring cell carcinomas are also associated with specific genetic mutations, especially in hereditary diffuse gastric cancer syndromes. For example, mutations in the CDH1 gene are linked to increased risk. Recognizing these genetic factors is important for assessing risk, guiding genetic counseling, and considering preventive measures for high-risk individuals. In summary, signet ring cells are more than just a microscopic feature. They help define the type of stomach cancer, signal a more invasive and aggressive disease, influence prognosis, and present unique challenges for treatment. Understanding their role is crucial for accurate diagnosis and personalized management. If you or someone you know is concerned about stomach cancer, it's always best to consult healthcare professionals who can provide guidance based on individual circumstances and the latest medical knowledge.